Hi, I'm Dr. Mihail Climov from Your Aesthetic Edge, and today I'll be answering some questions about breast augmentation. Breast augmentation is a procedure where we use a material to increase the volume, the size of your breasts. Most of the time for breast augmentation we use implants, and implants can be saline or silicone filled. Sometimes you can do breast augmentations with fat grafting. It is a big difference. Breast augmentation stands for increasing the volume of the breast. Breast lift is focusing on reducing the sagging or lifting the breast higher, and usually involves multiple incisions, only in very specific conditions, and not everyone meets them. First of all, you would like an increase of the volume. The distance or the degree of sagging is not really advanced, so very little sagging. The distance between your nipple and fold is not long, and overall we can meet an understanding that you might require a lift down the road. The best way to know is just schedule a consultation, meet your surgeon, and the surgeon will assess and provide you their opinion. There are multiple risks with any procedures, starting from scarring, pain, infection, bleeding, scars. However, specific to breast augmentation is capsular contracture, which is basically a reaction of your body to a foreign object, which is an implant, and it can be mild or more severe, and that's one of the common reasons why we have subsequent surgeries. However, in general, with new generation of implants and new techniques, the degree of capsular contracture decreased significantly. It is a fast procedure. It doesn't take more than an hour of actual surgical time. It can take 2 hours with anesthesia and everything, and it involves making a small incision. I personally do the fold incision, 3 to 4 centimeters, and dissecting the plane, going under the fascia. This is my favorite place, under the fascia. Sometimes I do dual plane in certain conditions, and creating the pocket, irrigating, injecting some local, inserting the implant with a special technique that we call minimally touch or non-touch technique, using a Keller funnel. It is a special funnel that allows the implant to slide in and then closing. Recovery is not that long. More initial recovery is about 2 weeks, where you will see some bruising, some swelling, some asymmetries, but after 2 weeks it's getting better and better. However, there are some precautions that I advise patients to carry or to follow some precautions, which are T-Rex arms and no lifting heavy up to 6 to 8 weeks. So your final results are about, as after any procedure, I say it's about 6 months. When everything settles, the collagen resorbs up to a year and reforms. The surgeon will help you, first of all, get me some wish pictures, and that will help me understand what is your vision. We can incorporate in this discussion your anatomy, your details of the anatomy, and what is possible, and we will try to find common ground. Current generation of implants, which is 5th and 6th generation implants, they feel very natural. This is a misconception. The implants do not have to be replaced unless there are issues with the implants. Most of the time, yes. However, breast implants or any breast surgery can potentially affect breastfeeding capacity. It will not affect your mammograms. However, there's a special technique, and you have to tell radiologists to apply that technique. You just have to tell them that you have breast implants, and they will use this technique to look and isolate your breast tissue from the implant. Once you're healed, you can exercise wherever you want, back to normal. However, my advice is always to protect your breasts and use supportive bra, and not a big deal. Current implants are more gel, so the gel does not spread around. This is why you have to evaluate your implants for rupture. FDA recommends after 6 years after implantation, then every 2 years after with MRI ultrasound. So what happens? We just take it out, put a new implant. It depends on what implants are you using, what is your anatomy, how much thickness of the breast tissue you have. So different factors are involved. I hope I answered most of your questions about breast augmentation, but if you have any other questions, I'm happy to answer them. DM me or schedule consultations with mine.